You are now listening to Protecting Your Nest with board-certified family medicine and obesity medicine specialist Dr. Tony Hampton. For more, visit drtonyhampton.com. Welcome to the Protecting Your Nest podcast, where we are all on a journey to achieve our optimal health. We do this by being continuous learners and by thinking outside the box. No matter what we are currently believing, we are willing to listen to new information that is evidence-based and the views from those who don't necessarily align with how we see the world. If you had a chance to listen to podcast episode number 14, it was focused on how we think, and I reminded you that your thinking is a reflection of your life experiences, and many of those experiences are the experiences of others. So it's important to continuously evaluate what's entering your brain. Like a scientist, you will systematically gather information and use that information like a researcher as evidence to make a hypothesis, to test it, and to use it to determine outcomes, which will ultimately define how you view the world and how you live. Ultimately, you will change your behavior based on what serves you as you strive to achieve your health-related goals. So the key is to not be so indoctrinated into your beliefs that you are not willing to see the world through the lens of others. So today, I thought it would be kind of cool and a good idea to have a guest who is not a low-carb enthusiast proponent, but instead attempts to heal his community with a plant-based approach. You may have heard of him. His name is Dr. Terry Mason, because he's been featured on multiple documentaries, including Forks Over Knives and Game Changers, to name a few. He attended Loyola University in Chicago, and he completed his residency at the University of Illinois group hospital programs and did his urology fellowship at Michael Reese Hospital in Chicago as well. He practiced urology for over 26 years with a focus on erectile dysfunction and prostate cancer. As a Chicago resident, we've heard his voice for years, since the 1990s, as the host of the Doctor in the House radio program on WVON 1690 AM. And some of his other achievements included founding the Center for New Life, dedicated to integrating diet, of course, and exercise and chronic disease management. He also served as the Commissioner of Health for the City of Chicago from 2005 through 2009, and shortly after became the Assistant Chief Medical Officer. His more recent role was as the Chief Operating Officer of the Cook County Department of Public Health since around 2013. He's even authored a book entitled Making Love Again, Renewing Intimacy and Helping Your Man Overcome Impotence. We are one of a few docs who actually regularly serve as guests on the Couch Conversations with the Doctors, which is more of a question and answer on Facebook Live with Congressman Danny Davis of Illinois and his fabulous host, Nikki Harvey. And I could go on and on and on, but I'll stop there in terms of his accolades. And I would like to welcome you, Dr. Mason, to Protecting Your Nest.
Thank you so much, Dr. Hampton. I'm really, really grateful to be here today. And I look forward to our dialogue, our exchange of ideas. And where we agree, we will, I will agree. And where I don't, I'll let you know.
Yeah, but and that's it. That's what I'm talking about. And I've gotten to know you a little bit being on the Couch Conversation, but absolutely, I think it's really important just to have a conversation. And I'm really excited about that. And I think my listeners are too. And I think that that's what we really want to share that message. And I really, again, thank you for being here today and just giving my audience that opportunity to hear a different perspective. I have not heard a lot of low carb focused podcasts talk to vegetarians or vegans. So I think it's important. But before we get started, I want my listeners to know that, again, my goal today is not for my low carb folk to be converted to vegan and for my vegans to be converted to low carb. It's really just for us to hear different perspectives, because ultimately both of our goals are pretty much the same. We really want people to be metabolically healthy. And I've learned from my functional medicine training that how our bodies respond to the environment varies. And for some of us, it may be a different approach that works for that individual. So this means that we have to think about bio-individuality to a certain extent to determine the best dietary approach that would be best for you. So that's the approach I really believe that we should take. I also believe that the standard American diet, we call it the SAD diet, is the diet that we both agree is not the right diet. So, in fact, I think most countries, I don't care if you're talking about Australia or any other country, their standard diet is also the wrong diet. So I think what we're trying to do is to get people to think a little differently about food. And now what I'm going to do is share my thoughts about a few things, and then I'm going to allow Dr. Mason to give his perspective. And then we'll let the audience choose the perspective that works for them. So let's get started, Dr. Mason. And I want to start with a little bit of a shocker. And I was tickled when we had our last couch conversations with the doctors live session. And you mentioned that you had a previous profession that didn't align with what we would expect from a vegan. So tell us a little bit about your past experience in the meat industry. And I think our audience will get a kick out of that.
Yeah, I just thank you so much. And I think I really appreciate the framework that you've set out, Dr. Hamilton. I think this is a way to have a conversation. It's really, as far as I'm concerned, people should make sure they get the best information they can get before they make any decision or before they change their mind about what they do. So my purpose isn't really to try to beat people over the head and with facts or anecdotes or anything else, but just to make sure that we have in our exchange, maybe there's some things that we both learn from each other that make color how we go forward. And I think that's what's healthy.
Yeah.
I did a lot of things when I was growing up. I grew up in Inglewood. And part of my first job when I was 13 years old was working in the grocery store.
Gotcha.
Across the street from my house. So I learned how to do things that we don't do anymore, like stamp the prices on the cans. We don't do that anymore, and mop the floors and do things. And over time, I always liked to learn things. And as I grew older, and I worked for this wonderful man who was from Mississippi, who was just a very articulate, bright man, and he was the owner. And then there was a butcher his name is Mr. Green, and he was the butcher. And I was sort of fascinated with what he was doing. I must admit, however, that I was so small in terms of size that I was smaller than most of the pieces of meat I was trying to pick up. So at one point I hired a friend of mine that also lived in the neighborhood who was a football player, particularly when Mr. Green wasn't there, after I learned what I needed to do to just get the things out of the meat cooler for me and bring them and put them on my butcher block or on my bandsaw or whatever I needed to do to do this. It was my real first initiation to anatomy.
Wow.
Because animals and cows, pigs, chickens, we all share some very common, basic anatomical features.
Mm-hmm.
And so the first thing we have to do is when we're eating meat, we're just eating muscle. Sometimes we eat some skin and some blood vessels and some nerves, but for the most part, we're eating muscles if we're not eating the organs of the animal.
That's true.
And so when you're eating meat, you should know that just like you have a biceps, the chicken has a biceps, the cows have one a little bit differently, but most animals have analogous and anatomical parts. And so part of being a butcher is how do I take these different parts and fashion them or cut them in such a way to represent the cuts of meat that we like to eat. And so, for example, when the cow is slaughtered and bled, and then sometimes halved, for example, I always tell people, just like you have ribs. Well, what are ribs? Well, the ribs you're eating are the same ribs that the ribs you have. And the short ribs, when we talk about short ribs of beef, The short rib is just mean that we just cut the rib with smaller pieces. That's all. But the same intercostal muscles that are between your ribs are the same intercostal muscles that are between the pig rib or the beef rib. And that's the meat that we're eating, that muscle between those two bones. And sometimes there's a big nerve that's in there as well.
Mm-hmm.
So I got accustomed to doing that. And when I learned even more anatomy, as I learned how to cut up a chicken. And in those days, all the chickens were whole. And though they were beheaded and gutted, but they were whole. And I learned how to dismember the chicken, because that was my job. I had to cut the chicken up to put it in a little paper container so people could take it home and bake it or fry it or whatever they're going to do. And I learned how to do that from Mr. Green, who was the butcher at that time. And I learned the value of having very sharp knives. And it got to the point where I could appreciate when the knife was dull, even though to many other people might appear sharp. But I got to the point, doctor, that I could cut a chicken from a whole chicken to 2 legs, 2 thighs, 2 wings, 2 breasts, back in about 30 seconds.
Mm.
And that's what I did. I learned how to make sausage, which is one of the reasons why I don't eat it today, because I know what is made from
what's
that,
in it, right?
hot dogs and everything.
Right.
So that, and then when I learned how to do the steaks, then I learned all the anatomy of the muscles of the back, all of the muscles of the shoulder, of the muscles of the hip. These are the muscles and the joints that you dismember, you take apart in order to get to the cuts of meat that you like. So much of the very nice steaks that people like the filet mignon, much of that is the psoas muscle of the cow. So, you cut this in a very, very nice way that produces a lean piece of, when I say lean, that means it has little fat for people to enjoy. So if that is good enough, I'll stop right there in terms of a sort of overall biographical sketch. But it was my introduction to, and of course we did pigs too. So I got a chance to really understand not only that, but even the processed meats, how they were made, because I used to make sausages and I used to make all kinds of stuff. And we made all that from the different scraps that were
left over,
that are left from the other things. And when you grind it up and put lots of seasoning in it, and you grind it to it very, very fine. Sometimes you pass it through a grinding machine 2 or 3 times to get it to that consistency. So now that had nothing to do with my decision to become a vegan. At that time, I was very much eating everything I was cutting. So
that's interesting.
Yeah.
Well, it makes you, even just hearing you talk about it, I just don't think many people go that granular when they think about what they eat, even if it's vegetables. I mean, just understanding how it comes from where it starts, the seed as an example, and it grows into something versus the animal, which is a whole nother level. And it's very interesting to hear you tell your story. And again, it sounds like it didn't really shape your decision, but certainly having that history helps you to have a perspective that maybe someone else wouldn't have. So I think it's helpful to have that perspective. And I think about the work you do and the impact you're trying to have. And I know that for me, it's about, changing the paradigm where we are not focused on, I guess you would say, managing disease. And we're trying to get to that place where, we're trying to heal and do things like that. But when I hear you speak sometimes, I hear passion. Like when we do our couch conversations with the docs, I hear passion in your voice. I know I'm passionate about helping people as well. So I'm thinking, if you could just speak a little bit to your purpose. Like I know you're in transition and you're doing different things and you're doing a lot of things, but what's your purpose? Like if you had to say, this is why I'm on the planet right now, what would it be?
Well, first of all, I think that the way, and of course, everyone has their own beliefs, but I do believe in God. I do believe in the creation. And I do believe that we all are like cells in the body of humanity. each of us with our specific purpose, whether we are a red cell or a white cell or a muscle cell or, whatever we are, we all have a function. And I really just believe that my function has been, because I've always been a bit of a rabble rouser, if you will, but I'm just really very disappointed that we I called myself and thought I was going to medical school to learn how to heal people. But I then learned, and I think that's part of what you hear in my voice sometimes, that what I really was an arbiter for the pharmaceutical and device manufacturers. That's what we were trained to do. I can recall when I started medical school in 1974, there was our nutrition, all the nutrition we got was one lecture for 30 minutes. That's all the nutrition we got for 4 years of medical school. That's it. And that wasn't really nutrition. It was really about deficiency states.
Mm-hmm.
That's what it was really about.
Mm-hmm.
It was about beriberi, scurvy, iron deficiency, anemia, B12 deficiencies, those folate deficiencies. So it was really about deficiencies. It was never about how we would, and this is something I came to appreciate because I didn't know that early on.
Mm-hmm.
And as I came to appreciate the absolute role, and when you look at animal agriculture, they have made animal agriculture a science. And unfortunately, they have done in many aspects to the animal what they're doing to humans.
Mm-hmm.
That they have created commercialized the feeding of animals. And that commercialization of the feeding of animals is really something that is, if you think about it, it's the same thing as what we're doing with people. So
Mm-hmm.
I really, really want to get people to understand that my passion isn't about, I'm not anti anything other than anti-ignorance.
Mm-hmm.
And we all do what we can to do something about that.
Yeah. And I think that's, man, you got a lot of work to do there. So, but again, I think part of what we're trying to do with this podcast is to, while people are driving and, instead of listening to the latest song, which we should listen to music too, music is definitely wonderful as well. We need to take opportunities to learn and grow. And so that's great. So, and again, I think we're aligned in a lot of ways. And another way that we're aligned is I think about increasing access to healthy food. And one of the things that we're doing within Advocate Aurora at one of our hospitals on the south side of Chicago at Advocate Trinity is we've partnered with the Chicago Food Depository to give healthy foods. And you would be happy because most of the food we give out is fruits and vegetables. I mean, you can't really give out meat during those types of events. So my question for you is, I think you've been involved in helping the community. So could you describe a little bit about some of the programs you've been involved in and increase access to healthy food, maybe with the church?
Yes. Let me back up a bit. As I began this journey toward really trying to get a better handle on what nutrition was about, one of the things that I really tried to do was to really understand what the science was and really began to understand and look at disease differently. And what I mean by that is, instead of looking at the disease as the disease itself, that we look at things that we call problems, like let's talk about a heart attack. And so I always like to begin my lectures by saying that, well, what is a heart attack? A heart attack really has nothing to do with the heart initially. It has to do with the blood vessels that feed the heart. and the blockages in the blood vessels. Well, how did they get blocked?
Yeah.
What was going through them? Well, the blood goes through them. Well, what's in the blood that would cause a problem to the pipe and clog the pipe up? What's in the what's in that blood that's flowing through that pipe or artery that's clogging up the system? And so the question becomes, well, what is that? Well, we call it cholesterol. We got a lot of things that we call it. Some people talk about it from an inflammatory point of view and things of that nature. But the key is that it comes from the food. And the whole purpose of all the events that happen to our food from the time we put it in our mouth until it comes out of our rectum as being used, being all of the things being extracted that need to be extracted, that process called digestion is solely purposed to put in and or take out nutrients in the food, in the blood, because everything is all of our organs, our small intestine, our stomach, the duodenum, what's happening with the pancreas, the liver, all of these accessory organs are all designed to facilitate and extract and transport to all the cells in the body the things they need to function. And if they don't get the things they need to function properly, they will function improperly. And we call that state disease.
That's fair. And I think about this question around cholesterol, and I think we both would agree that, in fact, I'll touch on that in a moment. I want to dive a little deeper into the cholesterol question in terms of, what the real issue is, and I'll come back to that in a second. I think I want to ask you real quick, though, before I even get to that. You've been featured, in a lot of documentaries that were vegan, and documentaries are tricky because on the surface they appear to have substantial evidence. Rather, you're doing a low carb documentary like, the fat documentary by Vinnie Tortorich, or a low fat documentary like What the Health or Forked Over Knives. Those types of documentaries feel very strongly evidence based when you watch it. So if you're a regular person, I mean, how do average people filter through the noise? Because it depends on which documentary you watch, which is what is going to shape your beliefs. What's your thoughts on those completely different perspectives? They both present a case, an argument. How have you ever had to kind of think through how either it's created in such a way that it resonates with people in a way that, how do you deal with that? Because I struggle with that.
Well, I think that pursuant to what I just said a minute ago, what I've found is what we need to do is, as best as we can, understand our digestive system. Because when you understand our digestive system, and as we learn more and more about our digestive system and the role it plays in supplying our entire body with the micronutrients each of our parts need to function properly, I think we get a better handle on what's really needed. I mean, for example, there'd be very few people that would argue that water is not necessary. Would you agree?
That's absolutely correct.
Yeah, most people would. But the question is, well, Kool-Aid is water. There's water in Kool-Aid. There's water in coffee. There's water in, you know what I mean? So that is the construct around how these ideas get, I don't want to say polluted, but they get confounded.
Mm-hmm.
Because people then say, well, this, it says, well, this is okay, or that's okay, or we can drink this, or we can drink that. But what's really happened is we've gotten away from what we need to drink, period, which is water, just good water. And so now you've got people talking about alkaline water and all that stuff. So when I think of things like that, to your point, I put that through my sort of sniff test, and I said, well, the water, okay, you said the pH is 9. I'm like, okay, the water's pH is 9. So let me think about this. So from the back of my throat to my stomach is a tube called an esophagus.
Mm-hmm.
And it's about 10, depends on how tall you are, 10, 12 inches maybe. And so I put this water in my mouth and the pH is 9. And then it goes very quickly down my esophagus into my stomach where the pH is like 2.
Yeah.
So how long does that alkalinity last, and what does it do? Well, it is, it's because people don't understand that acid-base balance is a function of a number of other systems in our body, including the foods we eat and the way that we breathe. So those things are all points where food can get, where what the role gets confounded. And we get the people sneak in with the, hey, you need to drink the alkaline water. This is better for you. Well, based on what? And the
Right.
science around food, actually, a lot of it, we have, because we haven't been doing very much of it, because our food science has come from the people who are trying to sell us what they want us to buy.
Right.
So I've got to look at what they're telling me with a jaundiced eye, because I'm not sure that they are operating. In fact, I'm sure they're not operating in my best interest. They're working in the best interest of making sure they sell what it is they want us to buy.
Right. And you combine that with the fact that most of the studies are, you know, food frequency questionnaires and epidemiological studies based on, you know, people being questioned. We can't, you know, lock people up and force feed them. I mean, there's examples, and I heard you give an example during the war in the past of, you know, there's some examples of when we stopped feeding people meat, for example, during the war, when you can clearly see what happens. But I think it's also true that when you combine what you just said, industry, and you think about how the studies are done, it leaves us in a situation where we don't really have the level of evidence that we'd like to have, but at the same time, uh, you know, you have to do some anecdotal things periodically until we get better evidence. So I think there's a little bit of a back and forth with that. But I know I'm about results. So for me personally, you know, I look at my own life. I say, well, what works for me? What doesn't work for me? And I, you know, if you think about it, I was a vegetarian for many years, and one of the things that I struggled with, because I felt pretty good. Let's be clear, I felt good. Only thing that made my vegetarian lifestyle challenging, that, you know, certain types of vegetables, Brussels sprouts and things like that, would create little gas problems. So I had to do Beano and things like that. And I don't have as much of an issue with that now. But my patients, you know, in a predominantly African American community, they struggled with the ideal of not eating meat. So it was hard. I'll be honest, when I ended up leaning more low carb, it was a little easier to get them to do it. So my question to you is, you've done this as a physician personally and as an physician executive. So talk a little bit about the challenges of getting people to consider a vegan lifestyle. What has that journey been like for you?
Well, let me just tell you a little bit about myself in terms of the whole vegan. I didn't even know what a vegan was, maybe 15 years ago.
Mm-hmm.
I didn't know, and really wasn't even trying to find out.
Right.
But I was a guy who ate a porterhouse or T-bone steak every day.
Every day.
Every day.
That's
7
crazy.
days a week.
Every day.
When I was a
That's
resident at
crazy.
Michael Reese, and there was a store over there called Mr. G's, and I'd have Mr. G because I knew the part of what I wanted with
Right.
cow, and then he sliced those things off for me, individually wrapped them so that I could freeze them, and I'd take one apart, and take out one out every day, and I'd even used to eat it with cereal.
Mm-hmm.
I couldn't eat too much cereal because I was lactose intolerant, so that sort of spoiled the whole milk thing for me. But what I'm saying is, and I'm getting to why this change happened to me. So One day, and in fact, I had a place that we put together called the Center for New Life, which was a place where I really began to understand the relationship of what we ate and how or if we moved affected or could affect the trajectory of our health. And so we had a place where we actually had patients come in. And there were other things that we were testing too, because we had men with prostate cancer. We were using drugs like certain drugs that were causing some bone and mineral loss. And there was a body of evidence that was showing that exercise could actually help bone mineralization. And so we used that. But the other thing that we were beginning to learn as I was dealing in the erectile dysfunction area about the role of endothelial cell dysfunction. But to go back to the meat, I was doing that. And one day I was in my own center on a treadmill, and I developed chest pain. And being a physician and hearing this stuff all the time, you're like, no, this is really chest pain.
Yeah.
So I called my cardiologist and met him over in the emergency room. And the next thing I know, I was on a cardiac cath table.
Yeah.
And ended up with having to have a stent placed in my heart artery.
Yeah.
And it was it wasn't super serious, but it was serious enough. And I remembered I had just talked to Dean Ornish because I was beginning to learn all these different things. And I wanted my cardiologist not to put the stent in. And I wanted to tell him that I told him that I would leave and go straight to Sausalito, California, spend 2 months out there, whatever I needed to do to be part of that program, get all the appropriate follow-up and what have you. Say, no, man, look, let me tell you, you're on the table. I got the catheter in now. I see this lesion. You are not going to get off this table. I'm going to put this stent in, and that's it. Mm-hmm. Your death will not be on my hands. Because I decided, and I'm telling you, this is the way it happened. And I tell this story in the book I'm writing. So I ended up with the stent. And so what I did was I said, I tell you what, I will, I'll do what, I'll obviously have to do what you say, but I'm not going to put anything in my mouth from this day forward that I know based on what I've read and understood is going to cause more of this damage in, my blood vessels. And what people don't know is that you just don't have these blockages or these problems in your heart. They're in all the blood vessels, all the arteries in your entire body, from the tip of your toe to the crown of your head. So it doesn't happen segmentally the way they make us think. And so I did that. That was how I started. That was how at that time I didn't drink milk or eat cheese. I didn't already because I was lactose intolerant. Didn't do ice cream, but I was doing a little yogurt. And it was really kind of easy for me to say, okay, I'm not going to do that. And after later on, I went to the Cleveland Clinic and I spent time with Caldwell Esselstyn, who wrote the book, How to Prevent and Reverse Heart Disease. And it was clear what was really going on. And I was angry because of all of our medical school education, we were never taught this. Nope. And it's actually criminal.
Yeah. It's beyond criminal, and everything I've learned that is the foundation of my podcast and my YouTube videos and everything else I do to have kind of a lifestyle practice is all, I hate to say it, most of it I had to learn outside of the training I had back then. And again, you need that training in terms of understanding how to do a calf, but how do you prevent a calf? We didn't spend a lot of time talking about how to prevent these cardiac procedures. So I think this is a good point for us to, I want to spend a little time with the second half of this conversation, talking a little bit about, low fat, low carb. And what I'll do is I'll state some things that I think and believe, and I want you to just give your feedback, and we'll
Sure.
move on to the next thing. So I was, again, I was a vegetarian for 8 years. I was kind of a vegetarian most of the time and a vegan some of the time, but basically a vegetarian. And the funny thing is that I transitioned, and all those guys you mentioned, Ornish, Elsa Stein, yourself, were all my heroes. And I was very much in line with that approach. And I definitely, it's hard to, deny the studies that were done by those guys. So, in fact, anyway, so when I transitioned to a low carb approach probably about a year or so after Forks Over Knives came out. And I did that. I did research for my book. My intent was to write the Fix Your Diet, Fix Your Diabetes book with a focus on vegan, vegetarian approach. And then what kind of shifted me a little bit was the studies, like the A to Z study that was done at, I think, Stanford. And they compared the Zone and the Ornish diets to the Atkins. And it seems like the Atkins had better numbers in that study. And then they had the Shy study that was, they compared low-fat Mediterranean and low-carb diet. And low carb kind of inched out the Mediterranean. So it just seemed, based on my research at the time, that the low-carb diet had better metabolic, numbers. So in essence, my shift occurred at that time. And so, and then I get additional training later, and I study with the American College of Obesity Medicine. And they start, most of those folk tended to endorse a low carb diet as well for at least obesity management. So what I want to do is just hear some of your thoughts about low carb versus low fat dietary options, because they both seem to get to, you mentioned as you were commenting, it does not happen segmentally, right? Heart disease. And I think we both would, agree that inflammation has a lot to do with it. And maybe the cholesterol is responding to the inflammation.
Mm-hmm.
So if you have two dietary options that both reduce inflammation, your thoughts on being able to have both of those as options.
Well, let me ask, if I can ask you a question very quickly.
Yeah.
Tell me what you mean when you say low carb diet.
Yeah, that's a good question. And I think that's good for the audience too, because low carb is interesting. So in my practice, it means that I encourage my patients to reduce their carbohydrate consumption by down to about 50 grams a day. If I'm aggressive and I want to do more of a keto diet, I would probably get it down to less than 20 carbs a day. Now, of course, I want people to eat real food, whole foods. And so rather it's a challenge. If you eat, if you're eating a bowl of rice, you may get to that number a little faster. So it may be better to eat cauliflower rice. And that way, what was maybe 30 or 40 carbs gets down to maybe 4 or 5 carbs per serving. So I do give my patients a list of things to eat. And what I found in my research and in my practice is that when a diabetic, for example, eats, cauliflower rice in the morning, and they may have, and they, of course, these are not vegetarians, so they may have some eggs with it, or even bacon or something, right? Well, the total carb consumption for that meal may be, 4 to 6 carbs. So as a diabetic, what'll happen is that their blood sugars won't rise because they're not eating a starchy meal, as opposed to Raisin Bran, which has 38 carbs, and a banana, which has 20-some carbs. And so what happens, what I found quite quickly, is that they don't have to take as much medicine. And I know that diabetes is an inflammatory condition by itself. I know sugar is inflammatory, and you could argue that the grains and carbs that will convert to sugar could indirectly, depending on the quality of that nutrient, could convert to an inflammatory response. So that's kind of where I lean, because now don't get me wrong, when I was doing a vegetarian or vegan approach and I was encouraging, I was actually known as a vegetarian doc. People were shocked when I started talking differently. And what happened was, it's like, again, as I mentioned earlier, the engagement was a challenge. Or people, and I think that's a cultural thing and multiple other factors. But for me, it came down to metabolic health and inflammation, and I felt like, are there more than one way to reduce inflammation in the body? And once I learned that there was another way, and it wasn't a decision based on, when I was writing my book, it wasn't a decision based on, what will people do? Was really, I was just seeing that there were studies that, and I'll probably link the audience to some studies. And if you have any that you mentioned during this conversation, we'll do that too. But it was just a lot of studies saying you can actually do this and actually get results. So that's kind of what led me down this path. And, but I do know from experience that, yes, I do have a portion of my patients who are vegetarian, vegan, and they're actually doing fine. And I don't know if and they can actually eat a little bit more on a carb number than maybe the next person. And maybe it's just the way they're metabolically set up, or they're insulin sensitive and they're not really, they don't respond the same way. So, but when I think about the African-American population in particular that we serve traditionally on the south side of Chicago, man, a lot of them struggle with insulin resistance. So my logical brain says, well, if it's insulin resistance, then what things raise your insulin? And that's what made me, it's just my logic beyond the biochemistry. I said, man, just eat something that doesn't raise the sugar. So the question is, if you eat things that don't raise the sugar and it's a piece of, it's like a steak, what else is going to happen? And I guess what I'm saying from my research, I haven't seen as much harm, assuming it's not that sausage you mentioned earlier, but it's the steak. So, and the steak doesn't have something added to it that would make it inflammatory. So that's kind of my angle as I think about this.
Well, in terms of where I sit, in terms of, because, prior to my being involved with the episode with my cardiologist, I really hadn't thought much about any of these things. As I said, I didn't have to worry about milk because I'm lactose intolerant, as many people are. Probably for good reason, because cow milk is the perfect food for baby cows, not people.
That's right. And one thing I'll mention real quick is, I mentioned this before, that in my nutrition studies, I learned that for most people in this country, between the ages of 5 and 7, you actually you stop making the enzyme to break down the lactose, the lactase. And then in communities of color, I think for African Americans, it was as high as 75% are pretty much, should stay away from, they don't have the ability to break it down. So, but there is a number, if I recall, I think it was in grams, but I think it was like around 12 grams, which is, like a half a cup of milk, most people can tolerate no matter what. But then when you start getting higher than that, 16 grams and higher, you don't tolerate it. But in general, it's probably not a good idea.
Well, I can just say that I haven't had any milk in probably over 60 years.
Wow. That reminds me of that ham comment you made during the show. And you said you hadn't had ham since 1969. I was born in 68. I'm like, my God.
Well, I haven't had any. I stopped eating pork in 1969 because I joined the Nation of Islam.
And got you.
And we didn't eat pork, so
right. That's absolutely true. Yep.
I just stopped. Wow. Just like that.
Just like that.
What do you mean by low carb?
Yeah.
Because, all carbs are not the same.
That's true.
So processed carbs, I think, are not as good for you as natural carbs.
I agree.
So when I hear people say low carb diet, I'd like to know exactly, what does that meal look like?
That's right.
So because, I think that you could say that people, those of us who are, and I hate to get in these titles, but are vegan, yeah, but that's a low carb diet from one point of view, particularly if you're not embellishing your vegetables with all manner of condiments. But if you're eating, if you go to the extreme on that side, and that becomes be a raw food vegan, that is probably as low a carb diet as you could ever get. And
Yep.
you have to, you can use your different oils that you need for that help transport the omega-3, 6s, and 9s, and all the other kinds of things that are
Right.
necessary.
Okay.
So I actually consider what I eat, and even though we call it vegan, but it's because of the amount of it I eat, I consider it it's low carb. It's low carb. I mean, I eat. I think the refined carbohydrates are problematic.
Yeah.
No matter what kind of diet you say you're on, I think that
I
anytime
agree.
you use refined carbohydrates that are, and when I say refined, that they're not that way in nature.
Now, does that mean when you say you're saying it's low carb, does that mean that you typically would have something like bok choy on your plate before you would have like a potato?
No, I'd
Or
have both.
you would have both?
I'd have both, and I also eat a lot of. I mean, potatoes are roots, so I
Mm-hmm.
eat a number of root things. I eat beets.
Mm-hmm.
I eat potatoes. I eat, but I don't eat them. I don't eat them dipped and fried in grease at
Mm-hmm.
375 degrees, because that.
Gotcha.
Because I mean, if it's low, I'm just trying to figure out what do you do? How do you manage fat in the low carb situation? What are the sources of fats that you use?
Yeah, well, I mean, I think that, even if you think about what I have for, I actually did have a smoothie today. So in my smoothie, my fat would be, sometimes, you have nut butters that you can put
Hmm.
in the smoothie, and avocado, that was in this particular smoothie today. I did have some blueberries, and I had you know, I think I had a couple of, well, I had some chia seeds and some flax seeds and things like that, hemp seeds. But, and I know there's like protein and fat there, but that's kind of where I'm getting some of it. Now, of course, I will have tonight, I think I have some steak to eat, but then with my steak, I'm thinking about bok choy because I'll have bok choy on the side and some green beans. So, but I think the thing that may distinguish us a little bit is what about, like, I would probably tell my diabetic, I'm not sure I want you to eat the rice or the potatoes, just because they're just a little starchier than it seems they can tolerate. Now you could argue if they're being disciplined and their diet is fairly clean and it's whole foods, maybe they wouldn't respond in a way that they do. But it just seems like something that has a carb, like if it's quinoa. Quinoa is a healthy grain, but I don't know if I want a diabetic to make that part of their sides if it's going to be 30 or 40 carbs for that one side. Now, of course, we got to think about the fiber, and it's it's a high quality nutrient. But my experience has been that their bodies don't metabolically respond in a way that's favorable. So for me, it's like if I'm vegan or vegetarian, I would probably lean more towards the non-starchy vegetables and feel pretty comfortable with that. But I would probably discourage some of the root things that it sounds like you're pretty comfortable with. And I guess if you had a diabetic in front of you, would there be any tweaks necessary, or have you found that with the vegan diet, as long as they eat vegan and they're not eating processed food, they tend to respond metabolically fine?
Yeah, again, I'm not an internist as you are.
Mm-hmm.
So I
Yeah.
don't manage diabetics, never
Right.
have. I always send them to people who do what you do. But I think that when we think about, that's why I don't like to, I just call it whole food, because
Right.
full plant, predominantly plant based.
Yep.
And when you do that, first of all, a whole food plant based diet is a low carb diet. I mean,
Mm-hmm.
I should say it this way. A whole food plant based diet is low carb because it doesn't have any processed carbs in it.
Mm-hmm.
Okay.
Got you.
So
Okay.
you're not eating processed carbs,
Got you. It goes
and
away.
it goes away. So there is no, I mean, you can eat, I don't eat even as a diabetic, because we know that obviously changes in the microbiome from eating this kind of way will help with dealing with issues such as insulin resistance.
Mm-hmm. Yeah.
So I don't see in the people who are plant-based, and again, and plant-based also goes back that way too, that you
Mm-hmm.
can be plant-based, but if you're drowning, you're cooking your foods and you're drowning them in oils or with salt or with other things, that doesn't make it healthy, even though it's still plants. You can eat collard greens, but if you got it full of all kinds of salt and everything else, it's probably not as healthy for you as it could be. And that's why I think some of the raw foodists make the connection that eating it is the way as nature gives it to us is probably fine. And I think even in those cases, uh, I think it was Doug. Oh God, what's his? He's in Santa Rosa, California. He did a lot of work in
Mm-hmm.
the Philippines, looking at people eating these purple yams,
Mm-hmm.
and his name will come to me in a minute. But and he found that the whole notion of carbs that are not processed or smothered in butter or in
Mm-hmm.
these kinds of things, these people, that's what they made their life out of. And there was a lot of work that he's done. I'm sorry that I'm having a temporary lapse here.
Oh yeah.
He'll come. I can see his face,
Okay.
but that doesn't help your listeners.
Right. That's okay. That is hilarious.
But
And
he'll come to me. But he's been arguing and proving scientifically that there is no issue with carbohydrates eaten properly. And
mm-hmm.
so that many countries around the world, the diet is predominantly carbohydrate. We
Right.
eat rice, it's vegetables,
That's right.
it's
It just seems like the combinations, like it seems like how you, because I've seen the same thing, and I'll even have people say, well, in my home country, we eat rice all the time. So I think it sounds like it's nuance, and what do you combine it with, and what do you eat? If you eat a potato, but it's not combined with the wrong thing, it may be fine, or maybe you can put butter on a asparagus, but you can't put it on a potato. Maybe the combination is such that it doesn't work. So it gets very nuanced, but I hear what you're saying. And that's why, again, for those who are listening, your body will answer the question in some ways. Like if you do a little bit of an experiment, and you have to have something to measure. So if you measure, the inflammatory markers in your blood, whatever that would be, C-peptide, apolipoprotein B to A ratio, whatever you're measuring, your body will answer the question, and it'll answer it pretty quickly. Like a lot of these changes, if you're trying to reduce your triglycerides, for example, I've seen people literally from one test to the next go from 200 to 50, and it was just a dietary change. So I just want to say that because I think there's nuance to this, which is why we're having this conversation. Another thing that's always, I mentioned earlier, that maybe we should just briefly talk about cholesterol. And I know it's been kind of demonized a little bit, and maybe for good reason. But I know that we learned about the lipid hypothesis that talked a little bit about the link between cholesterol and cardiovascular disease. And I'm not sure that hypothesis focused on inflammation or focused
Hello?
on cholesterol. Like we know more about the cholesterol particle size being important compared to maybe just the cholesterol by itself. So has any of that, the newer research or the changes around particle sizes or inflammation being the focus, has that shifted any of your thoughts about dietary cholesterol? Because my understanding is that maybe 70% of the cholesterol is from the body and 30% from the diet. Now, obviously, that 30% can wreak havoc if it matters, but has any of those things shifted how you think about cholesterol or what we should focus on? I know you're saying like I do measure some of the things that you wouldn't have measured as a urologist, but has it shifted your thinking around how important cholesterol is in our diet?
Well, the beautiful thing is our livers make a lot of this stuff for us.
Yeah, thankfully.
Yeah, because
Yeah.
these cholesterol moieties are backbones for a lot of the steroids that we need, and they're made using the cholesterol backbone that we can synthesize.
Yep.
We need.
Yep.
That's the great thing about this thing that we call our body. It will, if we just give it the substrates, if we just give it the basic ingredients, it will do
Hmm.
all the things that we need to have done.
Yeah.
I just think that you know, as a person who eats plants, I'm a 100% carbohydrate diet. You know, whether it's
Right.
beans, rice, or greens, you know, whatever it is, it's all carbohydrates. I mean, that's what plants are.
What
Plants
if
are.
you ate when you have dinner tonight? What's a typical plate going to look like for you? Like, well, give me an idea.
Well, tonight the plate's going to look like because I had some collard greens that I cooked,
Hmm.
so I'm going to have my collard greens, and I'm not, I don't have to have a whole bunch of stuff. I
Right. You don't eat a
really don't.
lot, right? And you don't get because my brain, like, if I eat a steak, which is what I'm eating tonight, and I apologize for that, but so when you when you eat your vegetables, is there ever an issue with I'm needing to eat again in a few hours? You get full when you eat your collard greens tonight. Obviously, I don't assume you're not gonna have cornbread with it, right?
No.
Um, so you don't have any issue with that hunger or anything because I know fat satiates us a little bit, So, what's your thoughts on you get full, no
Well,
problem?
the other thing I may do is I do have some of the Impossible Burger stuff, so I
Hmm.
might do that too.
I was going to
Um,
ask you about that. Are you comfortable with everything? Like, because my brain, this is just how my brain's thinking. And let me just say this: when I was a vegetarian, I was killing all of those because it was nice to be able to eat something that reminds you of a burger, right?
mhm.
And it did have good ingredients, but there was just a few things. I mean, I haven't looked at a label in a while, so I'm a little naive right now. But do you feel comfortable with all the things they have to put together to make that Impossible Burger?
Yeah,
Is it?
that's a great question. But let me tell you what I do. I don't fry it. I don't broil it. I don't do any of that. I boil it.
Okay. Mhm.
And so what I do is I take it. I slice an onion about a half-inch thick slice of
Mhm.
onion, and I put about half inch to three-quarters of an inch of water in a small pan,
Mhm.
and put it in there, bring it to boil, put the
Yep.
burger on top of the onion,
Right.
and
Wow.
I let it boil. I let it just
Yeah.
the burger is not the thing is not in the water,
It's
but it's
not.
the heat from the steam and what have you. Because there's a lot of oil in those things, a lot of oil,
Right. Right.
and I don't want that. But this
Right.
way, I can look at it, the oiling and the oil and some of the artificial, some of the coloring, some of all that stuff. And I'm not saying it gets rid of all of it, but what I'm left with is what it represents more of what I want.
It's and
And
that's
I will
good.
eat that with Ezekiel bread.
Mhm. Okay.
That's what I'll have.
That's
And I
okay.
found that works for me because
Yep.
again, I was never one that was into the substitutes that much. I
Right.
looked at the substitutes that they had that were vegan were those who for people who still needed, their hands
Yeah, they still
or cooking.
struggle. Right. Right.
And
That's
so,
fair.
because a lot of those things have so much salt in them, some of those,
Mhm.
they're, I mean, it's like, some of it's so bad. I'm just like, why don't you just eat the real thing? You know?
Right. Right. Well, that's my point. Like at some
Yeah,
point
what's the point?
you gotta be
But,
careful.
yeah, but I will have, and in my collard greens, actually, I have collards and turnips together. I now mix
Mhm.
all the greens.
Right.
Whatever I have, I don't care if it's collards, mustard, and turnips, or if it's collards, cabbage, and you know what I mean? I just eat them
Yep.
all. I just eat them all, and I cook it all the same way. And I found that works. That works fine for me. And I just, and some people might have some issues with, uh, I don't always. Sometimes I will use the Ezekiel bread from time to time,
Mhm.
but But I think that the thing is, you got to do right most of the time.
Right. There
That's
you
what you
go.
got to do. And
Yep.
so I tell people, and I tell my friends, I said, you know what? If I really wanted a piece of chicken, I'd eat it.
Mm-hmm.
Okay. I mean, I don't think that, I'm not going to go to hell because I ate a piece of chicken.
That's right. That's
But
right.
at the same time, I know that what I'm trying to do is not do that. And
Mm-hmm.
so my appetite for that is markedly diminished from what it used to be. I mean, I was a jerk chicken eating somebody. Okay? Jerk chicken, Kentucky fried, I mean,
Man,
no, I'm being honest
you
with
was
you.
doing
I
it. Yeah,
did
you was
all of
doing
that.
it. That's
Yeah, I
right.
was doing it.
That's
And
funny.
now I don't. And I don't think that people should beat themselves up. I think that you should do this because this is what you know works best for your body.
Yeah.
And all I
I'll
know is that when you eat plant-based, the one thing that your body does need is fiber.
right.
It needs that fiber, and you needs the insoluble fiber that you get from plants.
Mm-hmm.
And that insoluble fiber does a few things. As you know, we have 10 trillion cells in our microbiome. We got just a
Right.
number of cells, but more importantly, we have certain bacteria that grow in our gut.
Mm-hmm.
And what the science is showing that when we eat things that contain carnitine, like eggs and meat and shrimp and those things, that carnitine, through a series of that happen in our digestive tract, not the least of which is the flavin monooxidases in the liver, convert
Mm-hmm.
that into trimethylamine oxide.
Mm-hmm.
Trimethylamine oxide is one of those things that is a very potent, or is told to be, or touted to be a very potent um, uh, chemical that can create issues like irritation and
Mm-hmm.
like the other things. So, what we need to do, and those things are high in things like eggs, and it's high. I mean, eggs, it doesn't matter because I don't eat eggs anyway, and I don't eat the meat or the shellfish anyway.
Mm-hmm.
And of course, these things are what are, the way I look at it, they're problematic not because, oh, I've got this religion called, plant-based and that's against my religion. No, it's just a choice that I make in the foods I eat. That's all.
Right. Okay. You triggered me a little bit with that conversation. I think about I'm going to go to extreme with this comment and question. You think about my previous guest. I actually had Dr. Kristen Bear. She's I think she's a family doc. She's also board certified in obesity medicine. So she was really here in Chicago with us, and now she's in San Diego. So she's a carnivore. And then you have Dr. Kim Berry. He's a doc in Tennessee. He has a large following on YouTube. He's a carnivore. And then I had A. Fox, who's called the Black Carnivore. So I'm thinking about them. And I know Dr. Bear, she had lupus and with this carnivore diet went into remission. Dr. Kim Berry talked about his allergies. Dr. A. Fox talked about her allergies. And they essentially um, it's the opposite of what you would think. When I know that when I talked to A. Fox, she said that when she'll cheat and have things from the plant family, and maybe it's the oxalates and the phytates, those anti-nutrients. I don't know what's going on, but she just reacts to it. So I guess my thoughts are this: like, I know we're saying with this conversation that everybody's different. You got to choose what works for you. That's what I'm hearing. That's kind of that's my philosophy. But man, it just seems that some people do better with more of a animal based approach, and these are carnivores. So, what's your thoughts on people going to that extreme if it seems to work for them? Like if you get somebody in front of you and they're like, "Hey, I feel good when I don't eat these things, these plants." How have you thought about that in terms of how to deal with that type of situation?
Well, to be honest with you, I've never had that happen.
Mm-hmm.
I've never had anybody said I can't, I feel bad because I eat plant-based. I just haven't had that. That's not been my experience. And I've had a lot of people that I know. Now, granted, A lot of people, most of the people that I hang out with, we all eat the same way.
Right.
So,
So you're kind of in your own
so
little
it's
bubble in a way. Right.
so I think that, and I did it. I did. I did do it that way before,
Mm-hmm.
and I know that, and I'm going to just say this may sound a little gross, but I do know that one of the difference that I can definitely tell is in the frequency and the, I'm going to call it ease of bowel movement.
Ease. Right. Mm-hmm.
And people, and even the aroma of the stool
Go ahead.
changes. No, it
Get
does.
out of here. That's really going there.
Yeah, well, I went there. And, it changes. And all I got to do is,
I never put bowel movements and aroma in the same sentence. Let's just be clear about that.
you talking to me, man. I might say anything.
I know. We got to edit that.
Well, no, I think I don't think I
That
say
is
that on the
funny.
radio. You
Yes,
know,
amen. I hear you.
I say that on the radio. I mean,
That is so funny to me.
I think you have to understand that there is a difference. There
Okay.
really, really
Yeah.
is a difference in the ease, because if you're eating if you're eating things that contain fiber, and you're
Mm-hmm.
drinking water, uh, and you will find out. And I tell people to don't take my word for it. I learned it myself.
Yeah.
I mean, you go in our drugstore. We have in the drugstores in America, and we have walls of things that people take for constipation.
You got that right.
Walls of it, all kinds of
It's a
stuff.
whole industry. Yep, it's a whole industry. It's
Yep. And
crazy.
so but uh, I have not, I know people who regularly have to take these things. And I tell them, I say, you know what? Just for a week, try this.
Mm-hmm.
Just try this and drink a lot more water, but also just eat this. And I can
Mm-hmm.
tell you, I would say most of the ones that get back to me report that things are different. Now, that doesn't make a scientific study. The problem with scientific studies in our scientific construct, it's very difficult to do that with plants. It's very difficult to do it with food, because the myopia of our scientific discipline wants us to isolate a particular chemical that is particularly responsible for that particular action. That doesn't happen in foods. You can't do it with using foods, because there's so many things that are in the food, so many constituents, that whether it's this constituent or that constituent really gets blurred in this whole discourse. So we just know, for example, that obviously, and I would tell anybody, and I'll say this because I know how we're doing our time, but I did want to say we did a small study in our church with Dr. Kim Williams. And as you know, Kim is the head of cardiology at Rush. He
Mm-hmm.
is also the past president of the American College of Cardiology. And we in our church for Lent, we tried to recruit 50 people to go on a plant-based diet for Lent, just for
Mm-hmm.
those weeks of Lent. That's all. Because people typically give up something for Lent. So we said, do this. And what we then did was to make it all isocaloric, we then had the food prepared and delivered to their homes. So everybody that was in the study got the same thing. And we cautioned them because what we had done and seen before when we do our 10-day jumpstart, which actually gets to the question you asked me at the beginning with what we were doing at the church, every year, and I'll just take a parenthetic pause here, every year during what I call the season of gluttony. The season of gluttony begins on Thanksgiving Day, and it
Mm-hmm.
goes straight through to New Year's. That's the season of gluttony. That's when we eat more than we probably eat most of the time the rest of the year. And so coming out of the season of gluttony, I asked people, in fact, I asked the mayor when I was commissioner of health to let me ask the entire city from January 2nd through the 31st not to eat any animal-based products at all. And we met at different vegetarian, vegan restaurants all over the city. And that then morphed into what I was just talking about with the study we did with Kim, because we didn't measure anything with that. So this one, we measured TMAO, we measured those lipoproteins, we measured
Mm-hmm.
insulin levels, we measured a number of things, and the people were in their own control. So we measured it before they started and afterwards. And we asked people if they cheated, if they ate, and I don't like to use the word cheated, but if they decided to eat something that wasn't on our menu, just write it down. All we want you to do is just tell us that you did it, so we know how to use that if we needed to help us interpret the data. I can tell you the most striking thing we saw in just those few weeks, 5 weeks or so, was a 41% drop in our inflammatory markers. 41% drop in the TMAO.
Amazing.
Amazing. In Black people.
Yeah. You can't
So,
argue with that. I mean, you know, it's really just, when you hear this again, as I talk to you and the listeners, there are various ways to get to the target. And
mhm.
I clearly, when I saw the Ornish study and the data from that and plaque regression and all of that, I mean, you can't deny that. So I think it's going to really come down to people really understanding what's happened, what's been done, and saying, well, what's my path? What's the best way for me to get to where I'm going? We already know it's not processed food. It's not the standard American diet. So it's nice to know that there is a way and there is a path. And the only other uh, thing I wanted to kind of bring up for sure was this idea about fat and should we demonize it or not? I'm not sure, but anyway, so um, one thing that I wanted to share with the audience is some of the data around low carb, high fat versus other types of diets, and I'll share that in the links. But the resource that may be helpful is the Public Health Collaborative, and they do have some uh, data that would suggest that for maybe 2 out of 3 people who go on a low carb, high fat diet, they're likely to get normalization of their metabolic profile, just like you just suggested happened in this group that was being studied. 1/3 may see a bump in their LDL. Now the question is, does it matter? And there's some data that would suggest it's not the LDL, it's the particle size, et cetera. So nothing's in terms of your perspective. I know that is your perspective in terms of fat. Um, do you tend to avoid the oils as well with your vegan approach, or are the oil? Because I know some people. I know Ornish and Esselstyn are one of them is an oil guy and one's not. I can't remember now, but what's your thoughts on oils and fat in general?
Well, Esselstyn is the no oil. You'll hear him scream.
No, okay, gotcha.
You'll hear him scream that.
Yeah.
Particularly when he's got a class of people that he's working on trying to sort of reverse their atherosclerotic
Right.
process.
Right.
So,
Okay.
I mean, his diet is very, very strict. I sat there with he and his wife
Mm-hmm.
as I went to one of those classes at the Cleveland Clinic. I met with the physician who was one of the people who had this remarkable reversal documented on coronary angiography. I've seen the thallium thallium scans of the heart
Mm-hmm.
showing the before and after with better perfusion. So I got to say whatever he was doing something. And the
Okay.
most of the thing that he was doing was really just eliminating these things. And the fat, I'd eat. I don't think I eat. I might put a little oil in the water that I use to cook my greens, but that's about it.
Okay.
But other than that, I don't use any added oils or anything. Um,
Okay.
when I was, let me see, just think now. I went to one Italian restaurant, and I think that they had an amazing extra virgin something kind of oil from. It was really amazing, so I tried it.
Mm-hmm. Mm-hmm.
But for the most part, I think guys, what you do 99% of the time is what's going to make the difference.
Mm-hmm. Yeah.
And I tell people, don't put yourself in a prison, because all you're going to do is create resentment for the change that you're trying to create. Don't do that.
Yeah.
Don't do that. But at the same time, if you want to make the change, then commit mentally and emotionally to the change, and keep people around you that are doing that can help you through
That
your change.
supports you through that change. Yeah.
So that whether you're going to do whatever it is, because we already know what the default situation does.
It's bad news. Yeah.
We know
It's
what that
bad news.
does.
That's right.
And obesity, as I talked about on the show the other day, obesity is something we should anticipate or is expect in our society, because we
Yeah.
overeat.
That's right.
I mean, whether it's we just overeat, and when you look at and Neil wrote a good book. I don't know if you read it, called Cheese.
Mm-mm.
And he really, I mean, you think about what cheese is. It is milk, fat, and salt.
Mm-hmm.
That's pretty much what it is. And the some of the curds. I mean, that's what
That's
they do.
right.
They take the milk and they pour the rennet in it, or the acid that curdles
Mm-hmm.
it, and then they dry it out. And in some places, they just let it sit and what we would call spoil, but they call it aging.
Mm-hmm. They call it aging. That's
They
right.
call it aging.
Man, you
But they,
hurting
Mhm.
hurting somebody, doctor, right now. Somebody's hurting. In fact, one of the questions I was going to bring up during the YouTube live is what foods would you miss? And I bet you, for a vegan, for people who love cheese, that's one of the foods they would probably miss the most, because it's this so-called age product is highly desired in society. So it's crazy. What I love about our conversation is that it's nobody got hurt. No, there was no blood spilled. Yet we had a chance to touch on a few perspectives that I just wanted to just get a little insight into a guy who's had a chance to live in that world for quite some time, and actually you're friends with some of the most well-known people in the world in that space. So that's why I wanted to. And then you're again somebody I love and respect. We just happen to be in the same city, and you've had a chance to kind of spread your message throughout the world. So I just wanted to really appreciate you for that. And I do want to, the last question I always ask is kind of
Can I just
encompasses.
add one more thing about the cheese?
Oh,
One thing
absolutely.
that we got to remember about milk is casomorphs.
Mm-hmm.
And the reason why people, when you talked about were withdrawing from their cheese, because they really are withdrawing from their cheese.
Mm-hmm.
Okay? Because
Yeah.
casomorphs, the casomorphs in the milk are the things that I'm told that help latching to take place.
Mm. Oh, really?
Yeah.
Yeah, I'm gonna check that out because
Yeah, check that
we
out.
hadn't
This
gotten to
is,
that chapter in the nutrition training yet. So,
yeah.
but I'm gonna check that out.
And so
Okay.
the casomorphs do that. That's why when you get to the
Mm.
point where you got to have your ice cream and you got to
Mm-hmm.
have your cheese and there is a morphine type derivative that's part of the milk that
Man,
is which is used to help facilitate latching. So that, at least I was at a
that's
lecture. I can't remember. I don't know if that was Milton or who that was, but there's some people and I'll have to look that up for you. But it was fascinating to me when I heard it.
yeah. That's a nugget I had not heard, and yet that's one that I think those listening, we're gonna look that one up because I had not heard that. So,
Yeah,
and
Casey.
it just wow. Thank you for that. Wow. Okay, so we will hold on. And that's what I love about learning and interviewing, and you just get these little nuggets, and that's a valuable one when we're in front of the audience and we're talking. We need those little nuggets, so just things that people will remember. So, and I think that'll be one. So part of the journey, as you know, is the balance of all the different aspects of life. So when you think about this nest and rope that I use as my kind of framework for understanding what we need to do to prevent disease, we talk about the nest and the rope. So the N is, nutrition, and we're talking about that primarily today, but we also talk about exercise and less stress, more sleep, how we think, avoiding trauma, and the rope is for the relationships, making sure they're healthy, avoiding organisms that can harm us, and maybe adding the ones that don't, like the healthy probiotics, pollutants, avoiding those, and having life experiences for the E, and emotions that are healthy. So when you think about those different aspects of your life, what area do you feel you'll probably give the most attention to over the next year? What do you really want to improve upon or spend more time developing?
I want to improve my ability to communicate with people about the issues around our food, what we choose to eat, and the diseases that we get from them are not entirely their fault.
Hmm.
And we have got to, one of the things that I want to do much, much more is that we spend $3 trillion a year on sickness.
Hmm.
And sickness is what drives our so-called health system. We don't have a health system in America.
Hmm.
Okay, we don't have one. We have one that manages complications of diseases. And for that management, it supports several industries. You have to, in order to bill for seeing a patient, you have to say what's wrong with them, not what's right with them, what's wrong with them. And you get paid based on the amount of time and the complexity of that encounter. And the surgery, a lot of the surgery that we're doing is related to the kinds of things that we do. And I have a cartoon that I borrow from Dean Ornish where it has a picture of a sink that's overflowing.
Hmm.
And the water's going all over the floor, and you got all these guys with mops trying to mop up the floor. But nobody tries to unclog the drain or turn the water off.
Hmm. That's
And
crazy.
so that's what I see as our so-called health system. We're a bunch of moppers, and
Hmm.
our system does not look well at or support us turning off the water. That is, let's figure out how we can stop the disease. We're taught that you can't stop it. That's not true. The biggest issue that we have in our armamentarium, and if you think about what's happened in the food industry over the last 70 years, 70, 100 years, how it's morphed, how we've gone from now eating most of our food cooked in kitchens, not our own.
Wow. It's simple. I think, again, we're aligned there, and we are both saying to the world, we have to get to the root cause of disease. And if we do that, we won't have to mop up the floor anymore because we're going to stop the water.
That's right.
From the dirt, the water, all that stuff we're mopping up, won't have to do any of that. So and that's more efficient. That saves us money, saves the pain and agony and all the things that come with that. So thank you for wrapping up with that. And I absolutely hope you're able to do exactly what your goal is, which is to be able to communicate these messages and change the lives that are hearing your message. So thank you for that, and I appreciate you. And I definitely want to encourage anybody listening that we're going to have a link to the YouTube Live we're going to spend a little time doing. And during that, we're going to spend a little time having our guests to, talk a little bit about, what it's like to be a vegan. I'll have some specific questions around that topic just to kind of explain, what is there some vitamins I need to be taking, things like that, practical stuff. So, but today, I really appreciate you. So I'll talk to you in a moment doing that. And thanks again for being with me. Okay.
No problem. Thank you so much. And keep up the great work. And, just keep it up, man. To get this kind of word out is important. And not to do it in a confrontational way.
Absolutely. It's just who I am as a person. And I can't see any other path. So thank you. And today, we were able to view the world through the lens of through the lens of our guests. And in my mind, a giant in the world of nutrition from a physician's perspective. And I really appreciate him. And he's taught us a lot today. And the main thing is, let's heal through prevention. Let's not get caught up in this cycle of chronic medical conditions. We do not have to live that way. We were not born to live that way. And it's really about, how we prioritize our dietary choices and just understanding, the standard way of eating is not going to serve us. So I applaud you, Dr. Mason, again, your dedication, your work, the things you're doing to provide access to food. I'm trying to do the same on my end. So again, thank you again. And I think those who are listening for thinking outside the box and hearing this message today. I want to even thank Mr. Green, the butcher, for laying the foundation that he gave you, so you could see the world through a different lens in your earlier life, doing that type of work, and so if you enjoyed the time you spent with us today, definitely check out the YouTube Live that'll follow. And as always, until we meet again, continue to protect your nest. You've been listening to Protecting Your Nest with Dr. Tony Hampton. For more, visit drtonyhampton.com.